Okay, this lecture is on small n designs. So this follows Morling chapter 13, the second half of that chapter on small n designs. So in small n designs, the n refers to the number of participants or subjects. So in a study that is a small n design, by definition, has relatively few participants, and sometimes it only has one. It can be, which is known as a case study. Um, so when a researcher uses a small n design, uh, they're really gathering a lot of information from just a few people or even a single person. In contrast to when there's a larger sample, researchers tend to um, get a lot, just a little bit of information from each person. Okay, so in a small n design, each participant is treated separately. They're almost always a repeated measure. Researcher observes how a person or an animal responds to several systematically designed conditions. So, in essence, you're getting quite a bit of information from a single subject or from just a few. This is in contrast to a large N design in which ultimately participants are grouped. So, data from an individual participant is not of interest in and of itself. Um, you take data from multiple participants, you combine them together, and you often present that data as a group average. So comparing the average from a treatment condition to a control condition, for instance, or comparing averages across multiple treatment conditions. Okay, so the data, you're only getting a little bit of data from each participant, and you're comparing averages. In a small n design, you ultimately present all of the data for each individual. So, under what circumstances would a researcher use a small n design? Or why would a researcher use a small n design? Um, a first instance would be to study special medical cases. So there's rare diseases, or there are, in some of the examples that I'm going to refer to in this lecture, there's been patients that have had damage to areas of their brain, and then different parts of their brain need to be removed or lesioned. And so those provide opportunities, kind of rare opportunities, to study the way that the mind works and to identify specific regions of the brain that are associated with different cognitive abilities. So it could be speech or memory. So really, it's an opportunity to study special medical cases. A second example might be when researchers are really only interested in a particular person. So, in certain applied areas of psychology, like behavioral modification or even clinical therapies, the professional, the psychology professional, is really only interested in understanding or changing the behavior of a particular person. And so they might study that person and look at the effects of different types of treatments or interventions, uh, and to observe whether those treatments or interventions change the behavior of that particular individual. So in that case, the interest is really only in that patient, and in some examples, a professional might not be interested in even generalizing beyond that one person. Okay, so again, just to review this table, so we know that we've got we know the difference. Um, so in large N studies, we've got groups data. This can be correlational data, experimental, quasi-experimental, all the designs that I've lectured on so far in this course. But you can think of, in contrast, a small N study. Each participant is really treated as its own experiment. So doing so requires collecting a lot of data and then presenting that data for each individual. So for the rest of the lecture, I'm going to go over some examples of small n design. So I'm going to follow the chapter and talk about a very famous patient in psychology in studying human memory, which is HM. So I'll review that and how that small n design, really that case study has been used to make conclusions about the different brain regions that are associated with memory. I'll review 3 examples of small n designs that are used in behavior change. I'll give some other examples of small n studies, and then ultimately review the 4 validities in small n designs. All right, so Henri Mollison, or HM, is one of the more famous case studies or patients in psychology, not just in cognitive psychology, but really all of cognitive psychology. And if you took a class in Introduction to Psychology, Psych 101, maybe you learned about HM. Certainly if you take a class on memory, a specific course on memory, you'll learn about HM further. So when HM was 27, he had surgery to remove the front part of his hippocampus. So this is a brain structure that is involved in memory. And he did so because he had suffered from repeated and very debilitating epileptic seizures. And so it was thought that by lesioning the hippocampus, this would reduce or even completely take away the seizures. And so indeed, that's what happened. It was, the surgery was very successful, dramatically reduced the number of seizures that he had, okay? So those lesions to the hippocampus, as well as part of his amygdala, as well as his temporal lobes. So there were complications, however. As he was recovering from the surgery, his family and medical staff noticed that he didn't recognize the nurses and the doctors that were caring for him. He had longer term memory, so he remembered his parents and he could recall memories from before the surgery with varying level of accuracy and detail. Yet he appeared to have lost the ability to learn anything new because he just couldn't recognize these nurses and doctors. So they said, "Hey, this is weird." So he very graciously started volunteering his time, and he worked with a couple cognitive psychologists to better understand what was going on with his memory. And so 2 of the researchers that worked with him quite a bit, Scoville and Milner, ended up learning from him that the hippocampal lesions that he had on both sides, those bilateral hippocampal lesions, didn't affect his intelligence, it didn't affect his personality, it only affected his ability to form new memories. One of these researchers, Milner, and then later along with colleague Suzanne Corkin, ended up studying HM for over 40 years. And so they learned quite a bit. So he was one of the most, we could say one of the most studied patients in cognitive psychology. So they developed several tasks, and in seeing how he performed on these tasks, they ultimately were able to document that there's a biological separation between declarative memory. Okay, so our declarative memory is knowing that something happened, and then there's our non-declarative memory, which is knowing how to do something. So what they determined was that HM maintained his non-declarative memory. He still knew how to do things, or he could be taught how to do things, and he would even retain his ability to know how to do things. He just wasn't able to retain the memory that he was taught how to do it. Okay, so he didn't maintain that declarative memory. So for instance, the researchers taught HM how to trace a star pattern with a pencil while seeing only seeing his hand in the mirror. Okay, so that's on the picture in the slide. So over repeated trials, his mirror tracing skill improved just as quickly as that of a control participant that had an intact brain. Okay, so what this demonstrated was he had non-declarative memory. He knew how to do this task. However, each day when he saw the task, they're like, okay, hey, we're going to give you this star tracing activity. He claimed that he'd never tried it before. So he demonstrated a lack of declarative memory. He just wasn't able to retain a fact that he had done this task many times before. Every time he saw the task, he thought he was doing it for the first time. There were other examples as well. So they would put like a secret buzzer under the rug and say, okay, we're going to hide this buzzer and we're going to see if you can find it. And every single time, say, okay, well, how am I supposed to know? I've never done this before. This is going to take forever, whatever the case is. But by hiding it in the same place, what they were able to determine is that he, over time, got much quicker at finding it. So it's that even though he thought he was doing it for the first time, even though he would say, I don't know about this, I've never done it before, he clearly in his brain had the non-declarative memory, so he knew how to find the buzzer. Okay, and there was other examples as well, like remembering word strings and things like that. So that's just one example. And we might ask just how convinced we should be of the results of this research in this special case study using HM. Okay, so after all, it was just him. And, there were patients that they brought in that would serve as controls. So people that had intact brains, healthy memories, would be able to serve as controls. So that actually segues to this point, is that when we're evaluating these results, we should keep in mind that some amount of experimental control was present. And this is the case not only for HM, but in these case studies, they do still provide an opportunity for researchers and experimenters to have experimental control. So in the case of HM, when trying to test his ability to remember or recognize magazine photos or number sequences, they were able to compare his performance to age-matched control participants that had no brain damage. So even though he's an N of 1, he's a single case, they're still able to use a control group. Second, the researchers deliberately designed tasks that were meant to isolate and test different aspects of memory, such as the difference between declarative memory and non-declarative memory. Okay, so there's still the opportunity to use that control in the manipulation of an independent variable. And then there's, of course, the ability to replicate. So by using several different types of tasks that are similar in the sense that we're going to teach HM something new and see if he's able to learn it, but varying those tasks, they're able to, within HM, replicate the same phenomenon over and over, which is to show that while he maintains non-declarative memory, his declarative memory is he doesn't have it. So the second case, if we think about, again, balancing priorities or even advantages, is that these small N designs allow a researcher to study special cases. So just like a quasi-experiment takes advantage of just not things that are naturally happening in the world, like the passage of a law or a historical event or some sort of an accident, a small N study takes advantage of special medical cases. Studying people like HM gave researchers the opportunity to test which kinds of tasks are affected by having these lesions in the hippocampus. So which tasks really require certain brain regions, like those parts of the hippocampus, and which don't, and to do so under controlled conditions. So, HM presented an opportunity. It's very difficult to otherwise, and especially before the days of brain imaging, okay, where we're able to put people in an fMRI and look at different patterns of um, brain activation based on blood flow. Before that technology, this was the way to say, how else do we identify what regions of the brain are active? They had to look for these special cases of people that had those pieces of the brain removed and say, okay, so what can they do and what can't they do? So it allows them to study these special cases. Certainly, there are disadvantages. One disadvantage involves internal validity, which is the ability to conclude that a variable is a true cause of an outcome. So these cognitive psychologists really wanted to identify regions of the brain that are associated with declarative versus non-declarative memory. HM had lesions to the hippocampus, and that was a specific region that they were trying to identify and to be able to say, hey, that is if you have these lesions versus people that don't, that's going to affect declarative but not your non-declarative memory. The problem was he also had part of his amygdala and temporal lobes removed. And then further complicating the matter, his cerebellum was also damaged from anti-seizure medications. So he had multiple types of damage to his brain. And so that makes it more difficult to narrow down the specific region that is responsible for each of the memory deficits, really. Okay, so that's an internal validity issue. They weren't able to say it's this brain region and only this brain region that is responsible for the memory deficits because he had damage to other parts of his brain. Certainly, another disadvantage is external validity. As in the case of HM, but we can say more generally, patients in small n designs don't necessarily represent the general population very well. Okay, so we can't be sure whether the results from studies on patients that have had surgeries or brain lesions would apply to people that, in his case, didn't have a history of epilepsy. So he had these lesions, but before that, he had a whole history of epilepsy. So that's just one very salient variable that we don't necessarily know whether these results would apply to people that didn't have the same history of epilepsy. And, it's just, it would of course be very unethical to remove regions of a person's brain that don't have epilepsy. So it's just not possible to have that comparison condition. So with small n designs, there's very likely going to be issues related to generalizability or external validity because of how kind of special or unique the patients are. All right, so I'm going to go over 3 types of small n designs that are used to evaluate the efficacy of treatments or different behavioral interventions. So in the following 3 slides, I'm going to review 3 different examples of studies that were reviewed in the chapter. And these are really looking at treatments how do we evaluate treatments that are designed to modify behaviors of individuals. So the first example is called a stable baseline design. In this study design, a researcher observes a behavior for an extended baseline period before the intervention or treatment is introduced. So the idea is that if the baseline is stable and then the target behavior changes after the treatment, we can be more certain that the treatment is effective. So in the example that we're looking at, this looked at the effectiveness of a treatment that was designed to enhance word recall in an Alzheimer's patient. Okay, so what we have in the figure is the percentage of words that are recalled on the vertical y-axis. On the horizontal axis, we've got basically time. So we've got these 2-week intervals. So there's this baseline period, and then there's the treatment, and then there's the period after the treatment or the intervention. So what you can see is that over the baseline period, this patient's ability to recall words was not very good. However, once essentially the intervention was a rehearsal technique, okay, without going into details, but you can see that after that treatment, after this expanded rehearsal technique or intervention was given, the patient's recall very rapidly and dramatically increased. So measuring this stable baseline period for an extended period of time is really important for the internal validity for this type of study. Having this multiple baseline period helps a researcher rule out threats to internal validity that would otherwise be present if there was only a single baseline measurement, followed by then a post-treatment measurement. So you might remember from previous lectures what the textbook refers, and what I've referred to as a really bad experiment. And a really bad experiment is one in which you've got a pretest that is followed by a post-test. And that's it for only a single group of people. You don't have a comparison group. So if you only have that single pretest and then a post-test with no comparison, there's several different threats to internal validity, such as spontaneous change or maturation. There's history effects. There's regression effects. So the presence of this multiple baseline really helps rule out those threats to internal validity like regression or maturation that would otherwise be present if there's only a single measurement at a pretest. Okay, so in this respect, this multiple baseline period helps us be more confident about internal validity, that it's the treatment and only the treatment that is the cause of the percentage of words recalled. Okay, second example is a multiple baseline design. So in a multiple baseline design, a researcher staggers their intervention across situation, across times, or across contexts in order to rule out different alternative explanations. So in this example that we have here, it's based on the phenomenon that up to 30% of children with autism express a fear of dogs. So this is common. And it's problematic, of course, because if you're a family and you have a child that is born with autism, there's often family pets, either in the immediate family or extended family or friends. So it's very important that a child born with autism doesn't have a fear of dogs, and to try and come up with if they do have that, to try to come up with an intervention that will reduce or eliminate their fear of dogs. So what we have here is that in this one study, they designed an intervention to reduce fear of dogs using 3 children that were aged 5 to 10 that had autism. And so initially, these 3 children, they bring the children into a like a big room, I believe, like a gym or a gymnasium, and where they're able to stay a far distance from a therapy dog, and the dog is placed on the far side of the gym. The children are then told that they can go as close as they can to the dog, and then that distance is recorded. So distances are recorded over several days, and then once that multiple baseline period is collected, the therapist then begins a treatment called contact desensitization plus reinforcement, okay, which not totally necessary that you know all the details, but I guess the short of it is to see how it works. The child ends up sitting with the therapist, playing on a laptop. The therapist gradually scoots closer to the dog and says, hey, let's come closer. If the kid does, the kid gets their favorite snack, and as well as praise from the therapist. And then that process is repeated. Sessions last until either 30 sessions or until the child touches the dog. So in this particular study, each child got 12 sessions, and after 2 weeks are shown different dogs in different settings, and then the differences are recorded. So there's a couple things to notice. So we've got the graphs from each of the 3 children. The first thing to notice is that the baselines are fairly stable. So for each person, for each of these participants, the distance that they stayed away from the dog, we can say fairly stable. There's some variability there, there's some difference, but it's fairly stable. We can also see that treatment was started at different times. So either after a baseline of 4, 10, or 12 sessions. And that's important in order to demonstrate both the internal and external validity of this treatment. And the reason is because what you can see is that really the children didn't show any improvement until after this therapy. So that helps establish that regardless of when you start it, children won't show improvement until after you start the therapy. Okay, and then this was repeated across the 3 children, so you can see, even though it's a small n design, fairly dramatically with each child's data, you can see that you get the same pattern. Okay, and then the same thing, you also have the generalization effect that happened as well. All right. Third design is called a reversal design. In this type of a study, researchers usually observe a baseline period in which they're looking for a specific behavior, and they look at that baseline before a treatment is given. Next, what they do is they observe the behavior of the subject during the treatment. Then they remove the treatment to see whether the behavior reverts back, and that's known as a reversal period. So in this example, this is an example of an autistic person that had language deficits. The client ended up engaging in something called rumination, which is basically regurgitating swallowed food, chewing it up again, and swallowing it. So pretty gross, but apparently this is somewhat common among people that have autism, or at least it was with this patient. And it's an example that your textbook author uses, so I'm using it as well, despite the grossness of it. Okay, so the treatment for this, so what we see here is on the vertical axis is the number of times that this particular person engages in this rumination behavior, which is the bringing up that swallowed food, chewing it up again, and swallowing it. And so there's baseline periods, treatment periods, and then we've got these reversal periods, which are following treatments to see whether the behavior reverts back. So in the figure, we've got the rumination rates at several different baseline sessions, and then we've got the rumination rates during the treatments. You can see that rumination is high during the baseline sessions in the green, and it's lower during the treatment sessions in the blue. So this pattern supports the idea that the treatment causes the rumination to decrease, okay? Because every time that the patient is not in treatment, they revert back to the original behavior. So these reversal designs are appropriate mainly for situations in which a treatment might not cause a lasting change. So it could be that because of his disabilities, this particular patient, the rumination was reinforcing for whatever reason. And so because it was reinforcing, that's why the behavior returned back to the higher levels during those baseline or reversal periods. Okay, but it shows clearly that the treatment is effective because of the reversal pattern. In contrast, using a reversal design like this wouldn't make sense for several other types of interventions, and particularly like educational or skill building type interventions. It's not appropriate because once a student has learned a new skill, we wouldn't expect the a behavior to reverse, or we wouldn't expect for an ability to reverse necessarily. So in the case of the Alzheimer's patient that learned the technique for recalling words, this type of a design wouldn't be appropriate because she has the skill and we wouldn't expect a reversal. Okay, just some other examples of small n studies using some fairly well-known and famous research and theories from psychology. So the first of these is Piaget and his theory of cognitive development in children. So it turns out that, so for those of you that don't know, I assume many do, having taken Psychology 100, but Piaget was a developmental psychologist interested in the cognitive development of children. He developed a theory of cognitive development that is a stage theory that says that at different stages that correspond to certain ages, children acquire certain cognitive abilities. And he is kind of famous for some of these interesting and unique tasks that he created to measure these cognitive abilities. And so what you see in the picture here is his very famous conservation of quantity, in this case, conservation of liquid, in which children think that there's more liquid when it is poured into a taller but slender glass than the shorter but wider glass. It's because at a certain age, children have not yet acquired conservation of quantity. And indeed, you can just have a kind of a single volume of liquid and pour it back and forth into the tall glass and the short glass. And even though it is very apparent to children that have moved beyond this stage that it's the same liquid, so it's the same, children that are at an earlier stage of development will point to the taller glass and say there's more liquid there because it's taller. Okay, so it turns out that he developed this theory in large part through careful observations of only his 3 children. So he used his very famous theory was a small n design. I believe he had some other children, friends, neighbors, but that we can say were not necessarily similar or generalizable because like him and his children, they were all generally well-educated people, high socioeconomic status. But ultimately, this theory came from a small n design. It is certainly held up across the test of time. It's taught in nearly every Psychology 101 course. Part of the reason why is that even though it was a small n, he used very careful, systematic observations, and he did extensive replication in order to support his conclusions. Not to say that the theory isn't criticized. It is. There's been several reviews criticizing both the theory of stages as well as aspects of his methodology. But it just goes to show that there can be small n designs that have a very meaningful and lasting impact on a field of study like psychology. It's also worth saying that while his research methods certainly weren't perfect, he did create a research technique that many developmental psychologists use. And so basically it's his clinical method for interviewing children. And so it really has a researcher or a clinician or a therapist that works with children do extensive interviews with the child about their own thought process. So that was a part of his research methodology, and that's been one of the lasting legacies of his work as well, is this clinical method of semi-structured interviews where um, uh, a researcher or a clinician asks the child about his or her own thoughts. Here's a second example, again, something that if you haven't learned about it yet in Psychology 101, if you go on to take a class in cognitive psychology or in memory, certainly you're going to learn about Hermann Ebbinghaus. So he was an experimental psychologist who conducted a series of memory studies, and it turns out he was his own participant. So he made himself memorize long lists of words, actually of nonsense syllables, and then he documented how many of the syllables he remembered at different time intervals. What the figure illustrates is this forgetting curve. And so that's something that he described in his papers. So his own studies had an N of 1. He was his own case study. But again, through using things like precise experimental control, measurement, careful replication, these studies made a really big impact on the field of cognitive psychology and memory. All right, so let's evaluate the 4 validities in small n design. So these are the validities that I've been lecturing about throughout the course. So let's start with internal validity. Hopefully, as the examples in the chapter as well as in the lecture show, if a small n study is well constructed, internal validity can be very high. So these are examples in which using a stable baseline or a multiple baseline or a reversal, it is absolutely possible to have strong internal validity in a small n design. Okay, beyond those behavioral intervention designs, thinking about the work that was done with HM, it's absolutely possible to have high internal validity. Okay, in terms of external validity, certainly this can be problematic, but it does depend on the goals of the study. So if the goal is to generalize to settings and populations beyond the single participant or small number of participants, external validity can be quite problematic. However, that isn't always the goal. It's not always the goal to generalize beyond a single participant or to other populations. So medical studies, for instance, on treatments of rare illnesses necessarily have a small number of participants because it's a rare illness by definition. But if the goal of the research is only to treat that rare disease, generalization is not so relevant. It only is important to study those types of patients that have that disease. Okay. And it's true that research can take steps to try to maximize external validity. So for instance, findings can be triangulated by combining the results of several single n studies or small n studies with studies of other animals or other groups. So for instance, it's possible the researchers that studied HM, they compared his results to subsequent research on people without brain damage. So we can use those small n designs or case studies, and the results can be compared to others, and that helps us understand the extent to which the same findings are obtained and the extent to which the findings are generalizable. When it comes to construct validity, no matter what kind of study you're conducting, you always have to define your variables well. So construct validity is fairly straightforward when researchers are recording whether a person with a brain lesion reports seeing a particular picture versus not. Construct validity is also fairly straightforward when using objective measures such as memory for a string of numbers. How many numbers did you remember? That's fairly objective. Of course, things get more subjective. So in the example in which researchers needed to record the distance that a child gets to a dog, you need to have multiple observers. You need to check for internal rate of reliability. So in the case of looking at different behaviors, sometimes behaviors can be subjective or difficult to identify. So having multiple judges or raters would be important. So essentially, it just depends on what you're measuring. So if a construct is easy to define or possible to define precisely, if it's possible to come up with measurements that are objective, like how many words were recalled, construct validity can be very high. Okay, and then the last consideration is statistical validity. It's really not always relevant to small n designs. Okay, small n designs are unique. They don't rely on the same statistics that are typically used in larger n designs. So a correlation coefficient, a comparison of means using a t-test. These statistics just aren't used. It's not possible. So often in a small n design, whatever the effect of interest is, whatever the phenomenon is, okay, so if it's being able to recall more words, if it's being able to decrease the distance that one is, standing or sitting from a dog, as in the other example, oftentimes the effect is so strong that all you have to do is simply look at a graph or some other visual summary of the results, and that conveys the power of the treatment or the intervention. It is possible to convey the effect, although we wouldn't necessarily say that it's the same as statistical validity because statistics aren't calculated, so just not relevant. Okay, so that wraps up this lecture on small n designs. Hopefully now you have a better understanding of different types of small n designs, as well as when and why they're used, as well as some of the considerations for interrogating the four validities when a research design is a small n design.